welcome to another video from the CTAD Clinic. My name is Dr. Mike Lloyd and I'm the director of the clinic. Today I'm going to be looking at an issue that many people have spoken to me about in clinical sessions and also from the comments on the YouTube channel, and that's the link between autism and dissociation. Looking into this, I've realised that this is actually quite a huge topic. And it has the interest of many people, and I think I won't get through everything in a single video, so I'm probably going to make this into maybe a small series of videos. So I'll try and cover some of the introductory information today, and then as I move along I'll produce some more video content. And also I've been asking on Twitter for people's questions that they might want answered, and some folks have been very kind and they've put some questions on there for things that they would like answered in these videos. If you haven't seen that already, please go onto the Twitter feed, which is at Dr. Mike Lloyd, and have a look at the questions and see whether or not there's something that you would like answered, or you can put some of your own questions in the comment section at the end of this video. Okay, so to start with, the first question that many people have asked me is, can I have autism and dissociation? Quite a lot of the times the people are diagnosed with dissociative identity disorder or other specified dissociative disorders, so they're wanting to know, can they have both? The simple answer, and this might be where you stop watching the video, is that yes, obviously any person can have both autism and a dissociative disorder. Autism isn't independent of any other diagnoses, and nor is dissociation. So both of them can be had with anything from obsessive compulsive disorders to diabetes to rheumatoid arthritis. It really doesn't make any difference. These are not diagnoses that are purely related to themselves. So many people have autism and a number of other diagnoses, both mental and physical health, and with dissociation many people have a dissociative disorder as well as a combination of other physical and mental health conditions. It might be worth looking at some of the other YouTube channels and blogs that lots of people speak about their own personal experiences of autism and dissociation, for example, DID. And that expert by experience view is extremely valuable. I'm coming at this from a clinical perspective. The opinions that I'm going to suggest in this video are not really related to the research findings. There's not an awful lot of research about autism and dissociation. But I'm going to be talking about my own clinical experience in therapy sessions with people that I have worked with who have both autism and a dissociative disorder. Realistically, I suspect this comes down to there are three things which are worth considering when we're looking at autism and dissociation. The first is that there are certainly vulnerabilities. What this means is that we might actually see more people on the autistic spectrum with dissociative conditions than we might first have expected. And that comes down to the nature of why a person has dissociation, and it's a trauma-based problem. And many people with autism are very vulnerable to trauma. If we think about life going through school, one of the common experiences a lot of people with autism have is that they have been bullied or they've been misunderstood, and school has been incredibly difficult. And if we think that school takes place from about sort of 4 years old through to possibly 18, maybe even up to 21, it's entirely likely that that person may have experienced huge difficulties in friendship groups, in family setups, across the board for many, many years. And those traumas that could be experienced through bullying, through being misunderstood, from not having a sense of self, to not feel that they belong or welcomed in any social group, well, that could be traumatic. If we're thinking about attachment being traumatic, if the attachment goes wrong, look at the work of John Bowlby and Mary Ainsworth, attachment theory. The nature of our attachment systems are absolutely central to our understanding of ourselves and our ability to be able to function in the real world. And if you have autism, that attachment system can be incredibly difficult to get right, to understand, or for other people looking into that person to understand what is going on for them. Lots of people with autism get rejected very early on in life, and that rejection is traumatic for many, many people. So the first thing is that autism can be a vulnerability to trauma from a very, very early stage in that person's development. So from the point at which they might start entering nursery or into infant school, we're looking at 3 years old, we're looking at 4 years old, we're looking at 5 years old. These are key times in the development of the brain, and if that attachment system for that person is not good, it is not healthy, it is not productive, and it does not allow for good development of the self, then that person may well experience a huge traumatic attachment in almost any location that they go in. Which then brings on to the second point, that autism in itself is incredibly confusing because the world is not designed for people who are autistic. The world is designed for neurotypical people, in that the setup of it is geared towards a good and intuitive social understanding of how things work. So people with autism find that extremely difficult. So in of itself, the world that may not be traumatic for neurotypical people can be traumatic for autistic people. That almost any interaction with people can feel confusing, it can feel unpredictable, and can be incredibly anxious. And if we think about the dissociative disorders, things like depersonalization, derealization, that sense of being out of sync with the world around. So when a person really doesn't feel that they belong, or they feel that people around them are alien or potentially foreign, these are depersonalization experiences, when they just don't feel that they fit into the world, that the world around them is somehow the wrong shape or the wrong tone or the wrong colour. These are derealization experiences. So it could easily be that a person just going through the life that we all as neurotypical people take for granted, that actually that is very confusing, very unpredictable, and potentially traumatic in itself. So we're not necessarily looking at high abusive experiences. What we might be looking at is a person with autism just having an incredibly difficult life, just negotiating the pitfalls and the corners that none of us really understand why those might be difficult. If that person experiences them as difficult and they become incredibly challenging and they're happening day after day after day, then yes, we are looking at a predisposition to trauma built into that person's autistic experience of their own life. And I think the last thing that I'd like to cover today is that the nature of autism makes it harder for people to have those support systems around them. So one of the ways that people manage trauma, and one of the ways that people develop a resilience to trauma, is through the support networks, is the resources in everyday life. A person with autism can feel that they're on the fringe of things, that they don't belong, they don't have that friendship group, and they don't have the ability within themselves necessarily to articulate their own emotional experience of what is happening. So if a neurotypical person is having a very, very challenging experience, and there are resources around them, there are friends, there are teachers, there are maybe parents, there are uncles, aunts, brothers and sisters, there may be people around them that they can actually talk to about what is happening to them that are then helped. Someone with autism may not be able to fully understand exactly what it is that they're experiencing. So the difficulty that they are going through to find the right words, to be able to interpret the emotions that are going on inside their head, inside their body, to be able to relay those to other people in a meaningful way, to be able to achieve help so that these experiences don't continue year after year, is reduced because of the wiring in the brain. The autism sort of prevents a person from being able to really fully come to grips with and understand their own emotional experience. They have the full range of emotional experiences, but their ability to analyse, interpret, make sense of, reflect on, share with other people, and look to other people to gain insight as to what it is that they're experiencing is impaired as a result of the autism. So these three things in combination can make the likelihood of autism and dissociation coming together increased. There doesn't have to be trauma from abuse within this, it can be the trauma from everyday life. And I think if we understand that, what we realise is that actually many people that have complex trauma, that have dissociative conditions diagnosed, can have autism. Of course they can. And actually in my clinical work, I'm surprised by how many people that get referred into the CTAD Clinic have a co-diagnosis of an autistic spectrum disorder. So they come with the trauma, with the dissociation, and then in the background there is autism. And actually even when it's not been diagnosed, sometimes it's easy to spot. You can start working with a person and realise fairly soon into therapy that there is a high degree of autism in the description of that, how that person goes through their everyday life. So I think in my say everyday clinical field, working with people with a variety of different mental health conditions, not a great deal of autism. In the CTAD Clinic, when I'm working with a specialist field of dissociation, quite a lot of autism. these are anecdotal numbers, so I haven't had the opportunity to really sort of dig into whether there's been any research on this, but the first look that I have suggests that we don't know enough about prevalence rates to fully understand dissociation. We have good prevalence rates for things like autism in the general population, but the mix of the two, I don't think we really understand that, and I suspect that the results will be quite surprising. Anyway, I hope that the introductory video of this will be helpful to anybody that's interested in this field, whether people with dissociation, people with autism, or for therapists that are working with those sort of folks, that this is the start, I suppose, of a conversation about the nature of these two things happening at the same time, and an extra layer of skill for therapists and clinical services to be able to adjust the work that they do to fit the nature of both. It's no good being able to say, I'd like to treat you for autism, but I'd like to treat you for dissociation, but I can't because I'm not skilled or experienced in working with autism. We have to be much better at this, and I think having therapists and having clinicians on board clinical services that can work with both and learn how to fit them together and work with them together would be incredibly useful. I very much hope that this video has been useful. Please do leave any comments and questions that you might want answered on this topic in the comment section, and I'll do my best to fit some of those into the videos that we produce. And as always, please like and subscribe for more content from the CTAD channel. So I will look forward to putting another video together very soon, and in the meantime, please do take great care.